Hello and welcome. Today we bring you a special guest, Dr. Vivekananda Reddy. Uh, Welcome, Vivek.
Thank you. Thank you very much, Rahul.
Dr. Vivekananda Reddy is something common with me as well. He's finished your medical school and he did his post graduation in the business administration. So as well, so that is we want to bring that particular aspect to our viewers today. Most of us we decide to go into residency, junior residency, and so on and so forth. And some of us we try to go into a little bit of a different path. We have heard last week Dr. Maya Sharma on pharmacovigilance part, and we are bringing Vivek at this time to talk about his experience, why he chose those route, and what is in it for the young graduates as well. So Vivek, first of all, please introduce yourself. Tell us your journey of education and other parts.
Sure, definitely. First of all, thank you very much, Rahul, for having me on your platform. It's indeed a great. It's my pleasure to sort of talk to you and the followers and everyone that who is listening to me through this forum. I'm Dr. Vivek. I did my MBBS, and I always because of the parents or because of my background into the healthcare and all. My parents wanted me to become a doctor, and then at a small age, I wanted to sort of get into medicine. So I got into the medicine without any hustle. But once I sort of got into the medicine and started practicing, I realized that this is not something that I can do for my entire life. So that's when I thought of looking for alternative opportunities for me, but at the same time bring my healthcare expertise into my core work. And I started exploring different opportunities or the possibilities that can happen. So I reached out to multiple people who have done something after MBBS, and as a part of that research only, I ended up talking to most of the people who did MBA after MBBS, and it happened that I wanted to sort of follow that path. So I did my MBA from one of the top tier institute in India, and then from MBA I got into a leading pharmaceutical company, and within the pharmaceutical company again I sort of did a lot of different cross functional experiences. Right now I work with a global brand director and sort of help the company in terms of launching new molecules, the commercial strategies and things like that. Yeah. So that's a basic brief on me.
No, fantastic. That's a great story. So now let's go to the main question which our viewers have asked, and that's why we brought you here. The story is that when you take some of these routes, people ask you why would you do it, and you said that it was the clinical care was not for you, and you don't want to keep doing that thing for several years or several decades. So tell us your reasons and what was your reasons and how you justified yourself and justified to others who may be curious at the time.
Sure. Thanks for asking that question, Rahul. Indeed, that was one of the common questions that I get. And in fact, that was a question that runs around, multiple minds. We never get the proper answer to that. And I'll tell you my story as to how it all started, right? So when I was in medicine, or for that matter, when I was practicing also, if I have to look at a newspaper, a leading business newspaper, let's say, and I would not understand a small word also. Like I'm so focused and my knowledge is so deep in one subject, which is medicine, and I was like clueless as to what's happening around me, whether it is business, economy, technology, politics, nothing. I knew nothing, and I am a person who wants to explore, who wants to understand and make a sense out of the world, which was not happening me with being a physician on a full-time basis. So that made me really uncomfortable. So that's not me. I wanted to sort of go out of that and sort of do something for myself. So that's where I sort of started understanding what are my top reasons to do MBA, right? So like I mentioned, right, first thing is that I wanted to explore. And with me, practicing medicine, let's say I become a specialist in anesthesiology, and I can't sort of, go back to cardiology or let's say neurology and become a neurosurgeon or something like that, because it takes a lot of time, effort, and skills to sort of, build that. While with an MBA as a career, I can switch the functions easily. I can explore, switch the function, and then have that multiple options at a place, right? That was one of the leading important points for me to sort of get into MBA. And on top of that, so like I've mentioned, right, I was not making sense of many of the things that are happening around me, whether it is economics or even the stock market also. I didn't know anything about the stock market, and I wanted to basically understand how it exactly functions. Not that I wanted to become a full-time trader or something like that, no. But the point is, I should understand the basics of everything, and that stock market is like, really something basic, so basic that everyone should be aware of. The personal finance, for example, how you manage your money is something that everyone should know, whether you're a doctor, a techie, or even a politician, right? And and finally, the peer group that you get through MBA is something that is exceptionally good. Especially, one advice I would give to all the budding physicians who wanted to sort of do something like me, who wanted to get into an MBA program, is that do MBA once and do it from a really good college, because the peer group you get in a good MBA college is going to be profoundly impactful on how it is going to shape up your career, your paths, and things like that. And those are the things that really made me to sort of choose the path that I chose.
Absolutely. And I think rightly so. And I would echo that part as well. When doing MBA is important. Any postgraduate degree in business administration, master's, bachelor's would be very important for anybody for that matter. And networking is an amazing thing. You rub shoulders with future company CEOs and directors and managers and so on and so forth. So that's a very good advice in that regard. Let me flip this question. You don't have to be a medical doctor to do MBA or postgraduate training in business management or business administration for that purpose. How your medical training has helped you doing the roles what you've done since your business administration training, that because you had that knowledge, the basics of physiology, pathology, or at least the initial clinical training what you had it. So let me ask you that how that has helped you in your roles or understanding or doing your job better.
Yeah, absolutely. I think that's a very important question. And yeah, obviously, because of my healthcare background, I never wanted to sort of, let it go waste, because medicine sort of is a very specific expertise that you have to sort of, gain through a lot of rigorous training when you're in the medical school, right? And that's why I wanted to remain in the healthcare at the same time on the business side. Now, coming specifically to your question, how it helped, it definitely helps, because see, you can't train a particular person from the other background on a therapeutic area, and that person can't get deep expertise into the therapeutic area just like that, because we have spent years, multiple years, on understanding the anatomy, like you mentioned, physiology, pathology, biochemistry, and further, coming to the medicine, how you examine the patient, what are the typical symptoms, and then how do you diagnose, whether it is through clinical examination, through laboratory examination, through radiology, or whatever, right? Ultimately you make sense out of everything together. Holistically, you look at the patient and make sense. So that deep therapeutic knowledge and understanding of the entire healthcare ecosystem is really going to be useful when you are into these commercial roles. I'm not saying that it is specific to pharmaceutical industry, but take any industry for that matter. It can be a hospital related industry, because you understand the hospital system so well that you can design effective systems and make those effective strategies which can sort of improve the patient as well as the hospital outcomes. And similarly, it's applicable whether you are in the drug development as such, or even the commercial space, or whether you're in the communication, patient communication, or any other function which you are interested in, right? There are a plethora of functions and options that you can explore after you do your MBA, which can still be relevant, and you can still use your deep expertise that you have gained through medicine, and that will always help you.
Fantastic. No, so good to hear that. Let me ask you for our viewers who don't know you, if you want to share a fun fact about you, which you are comfortable sharing, which not very many people know about it. What would be one fun fact about you?
Uh, one fun fact about me. I don't know whether people will find it fun or not, but yeah. Um, I mean, so again, I mean, it's not. I mean, I would not say it's so funny, but yeah, I mean, one hobby I can mention if it is okay for you.
Absolutely.
Okay. So I mean, so I sort of, I grew up reading a lot, and because of that only I got into medicine. the medicine, but I continued that. But at the same time, I got an interest into the psychology, right? And I got an interest into the area where people take decisions. So the decision making, uh, the behavior and judgment, right? The behavioral biases we all have, and how that affects your judgment and decision making. Like 90 to 90% of the time, we sort of make those decisions which are not thought through. It's like system one level thinking, that you do it out of your compulsion, right? And I read a lot of that stuff, and I try to understand the behavior, judgment, the marketing decisions and things like that. So that is something, one area which is interesting for me. So I do a lot of reading on that stuff. In fact, that can affect the way we also trade in the stock market, right? That's an area which is called behavioral finance and business valuation. So I'm like a little bit interested into that stuff as well.
Well, good to know. Probably we might have to interview you again. You have mentioned the stock market quite a bit, so it's looked like we might have developed some expertise there as well. Right now, it's going on so bad at the time of recording the video, both abroad and in India, for that matter. Oh, this is fantastic, short and sweet. So, if you can provide a take-home message or a summary of what you talked about today to young uh, graduates, what would be your take-home message for them?
My takeaway is very simple, that don't compromise till you sort of find your passion. So you need to really like the job that you're doing. Unless you like the job, you'll not sort of give your best, and that would have repercussions. So you want to improve the longevity of your career, then you really have to do something that you really like, and that would sort of put everything else, including money, on the back seat, and outcomes will happen once you sort of focus on your work.
Such wise words. Thank you so much. Don't compromise for anything. Don't settle down for less until you are satisfied. Thank you so much for being here, Vivek, today. Dr. Vivek Reddy, finishing your medical school and postgraduate training in business administration. Uh, Viewers, please write in comment section what you liked about it and what you like to have more from Dr. Reddy when we may bring him back again to our channel. Like and subscribe to our channel, and then we release videos every week. So please be watch out for that. Thank you so much again, Vivek.
Thank you very much, Rahul.